Yeah,
What's schizophrenia?
Oh, so schizophrenia, now that's a tricky one. It's pretty complex, but schizophrenia is essentially a chronic condition, a mental health disorder, where the patient's connection to reality is disconnected, meaning they have some type of psychosis, meaning there are episodes where the patient is not grounded in reality. That's what schizophrenia is. Schizophrenia has three major stages, right? And so I want you guys to think of the three stages as like the infectious stages, although it's not an infection, but if you know the prodromal, the acute, and the rehab phase of any particular infection cycle, well, that's kind of how schizophrenia works as it exacerbates, because schizophrenia has exacerbations and then remissions. So as the patient starts developing these psychotic episodes or these schizophrenia episodes, they have a what you call the prodromal stage, where the patient doesn't really manifest outright positive symptoms of schizophrenia, meaning delusions, hallucinations. In mental health, positive means an increase in thought process and physical activity, not necessarily good. So the patient won't have those signs and symptoms yet in the prodromal phase. But as the patient moves into what we call the acute phase of schizophrenia, that's when they're going to have the really obvious psychosis, disconnection from reality. They're going to have delusions, hallucinations. They're going to be disconnected from reality. Sometimes there's specific types, like they have paranoid schizophrenia, they have catatonic schizophrenia, because they manifest in very unique ways, and we've cataloged them based on the behavior. But that's in the acute phase. You see those pronounced symptoms in the acute phase of the schizophrenic episode. Now, normally we treat these with antipsychotics. Keep in mind that there's typical antipsychotics and there's atypical antipsychotics. And generally speaking, your typical ones are the ones that have those profound extrapyramidal symptoms, and your atypical ones do not. But you give medications like Risperidone, right? Now, after the patient transitions into the convalescent phase, or in the not rehab phase, but in the third phase of schizophrenia, where the symptoms are going away, those positive symptoms that we were talking about, they go away. They're not as pronounced anymore. But the patient will have negative symptoms. And negative is talking about a decrease in emotion, a decrease in thought process. So we're talking about depression. We're talking about the patient has anhedonia, where they don't find any meaningful pleasures in anything that they do. And they stay confined to bed and they don't want to get out. And that's kind of how the cycle of schizophrenia works. So they have to be on their medications to ensure that they don't have these exacerbations, because the thing about schizophrenia is that it has episodes of exacerbation and remission. And keep in mind that people with schizophrenia, they believe the delusions, they believe the hallucinations. So safety is of utmost importance when it comes to schizophrenia.
Thank you.